So yes, the TNM, the tumor nodal metastases staging classification, was revised and implemented, the new edition, the 8th edition, in January of 2018. The major changes were primarily in the description of the size of the tumors. So it created a lot more clarity in terms of tumor size. And in the classifying metastases, whether it's one metastatic site versus multiple metastatic sites. Another really important aspect of the new edition is a better evaluation or assessment, if you will, of unusual scenarios within the staging system, and that is the multiple lung lesions, whether they're multiple synchronous lung primaries or multifocal adenocarcinomas, or these very unusual pneumonic type cancers. So a way to begin to better understand the complexity, if you will, or the diversity, heterogeneity of the disease through the staging system. And it's important because the staging system is designed to help us better communicate. It's sort of like a language of its own. The Fleischner guidelines are guidelines that help clinicians manage pulmonary nodules that are detected on CAT scan incidentally. And they give you certain criteria: size of the nodule, appearance of the nodule, and based on the individual's risk for developing lung cancer, it gives you parameters as to how you can follow those nodules. And they've been, developed for many, many years. They were revised and new guidelines published in 2017, and they're a great tool for clinicians to reference when they want to make sure that they're doing the right thing for lung nodules. There are separate guidelines that we use for nodules that are detected as part of a screening program. So if you're undergoing lung cancer screening, there are similar guidelines. They're called lung RADS guidelines. And again, a way to help clinicians manage nodules, right? So that we have a common knowledge, a common a way to ensure that we do the right thing for patients and not cause harm. For lung cancer risk assessment and screening, there are several. The one that I commonly use is a source called shouldiscreen.com, and it's a really great program because you can, with the patient in the room, go through the various other risk factors that are important when we think about lung cancer, because lung cancer risk is multifactorial. It isn't just, smoking, of course, is really important, and age, but there's so many other things that go into risk. Having chronic obstructive lung disease, having a family history of lung cancer, and you can go through all of those risk factors and calculate using a risk prediction model what that individual's risk of developing lung cancer might be in the next 6 years. And then it helps you discuss all of the benefits of screening, the early detection of lung cancer and treatment of lung cancer, but it also helps you address some of the potential risks of screening, the finding a nodule that doesn't turn out to be cancer that may need to be biopsied or followed. So patients can have a better understanding of what screening is going to entail. It also allows you to promote tobacco treatment, which is critically important, and encourage patients to ensure that they follow up, right? Because screening is all about commitment, and you want to come back for your scans, and if we find something, we want to be sure that we're able to get you back into the clinic to make sure nothing bad has happened. There's a new program that's being developed combined by the American Lung Association and the American Thoracic Society. It will be a web-based program to help clinicians and providers who work with screening go through the process of implementation of screening programs, shared decision making, tobacco counseling, the risks, the benefits and the risks of screening. That will be launched sometime in November of 2018. But they're really wonderful because when you have a program on a screen and you can interactively, right? And get the patients to participate in the decisions, I think it helps with the shared decision-making part of lung cancer screening.